Hello there. I'm Doerr. And this is my video for diagnostic process. My professor is Tony Cormier. Let me begin by saying, I worked to keep an open mind when reading this book and it was difficult. I was very unsure about what to think when reading Robert Whitaker's book Anatomy of an Epidemic, Magic Bullets Psychiatric Drugs, and Astonishing Rise of Mental Illness in America 2010. Coming from a place where I personally understand the benefits, impact, and importance of taking medication for severe mental illness, and what the lack of access or shame surrounding taking medication can do, I did not look forward to reading a book where it would only further expand the shame and difficulty that comes with the movement of antipsychotic or anti-medication. I was pleased that Whitaker spent a lot of time on facts. He gathered and shared a lot of these statistics and numbers with the reader, but it felt too anti-psychiatry/anti-mental illness. I still was not quite convinced that he was writing from a neutral perspective. His motive definitely seemed against any medication for mental illness. The numbers, while important, do not look into the narratives of these individuals. Especially in recent years, it has come to light that mental illness is not something we can continue to be quiet about. It only is expanding the shame and rates of suicide and suffering for so many. We need to make it an open dialogue so that we can help more people. Trauma is something that affects almost every individual in some way, and Whitaker fails to address this. Severe mental illness expands to people who are in jail, prisons, and homeless, and we cannot keep medication from these people. He claims medicine is a short-term fix but causes long-term failures and expands this so-called epidemic of mental illness. I believe that we really need to find a place in the middle of this conversation instead of Whitaker's extreme disdain and opposition for the world of medication for mental illness. Mental illness exists. We need to confront the abuse within the field and those who are capitalizing on the mentally ill to gain money, but we cannot take away the experience they are having. Let's use numbers and facts that are grounded in science but embrace the position that these individuals are struggling, often alone, because we have perpetuated an experience of shame and fear surrounding the mental illness. As we are unsure about the exact cause of mental illness, it can be hard to respond to a client who is asking about the cause of a diagnosis they have been given. For me, it is important that we expand our clients' own personal knowledge so they can best understand their own diagnosis and how it maybe came to light. Firstly, I would explain the many different aspects of an individual that might lead to a mental illness. Mental illness causes can be biological, complex beings, psychological, nothing is ever one factor but usually a combination of many things that make us who we are, including our mental illness. Some possible biological reasons for mental illness could include the chemicals in our brains, which are our neurotransmitters. Oftentimes it runs in families passed through genes. We may carry the gene, but it can take a traumatic event, stress, or abuse to trigger the illness. Substance abuse, or brain injury or brain defects. Some psychological causes may be severe psychological trauma, suffered as a child, early loss, neglect, inability to relate to others,
some environmental
death
causes
or divorce,
might be a
feelings of
dysfunctional
inadequacy,
family life,
low self-esteem,
changing jobs or
anxiety,
schools,
anger, or
social or
loneliness.
cultural expectations, substance abuse by the person or the person's parents.
The recovery model can be quite important in the world of social work, along with any treatment of mental illness. For me, I could see the impact of the recovery model for anyone that has suffered trauma. Regardless of what field you enter into as a social worker, the population you are working with has encountered some form of trauma that needs to be treated in order to put them in a place where they can be successful, independent, and safe. In my placement this first year of graduate school, I would use this recovery model to cultivate hope in the individual or group by helping them see what a life of healthy living, education, job, and wellness could lead to. Next year I will be working in the VA domiciliary and would use the recovery model to remind those who are battling suicide of the many components that will center and focus the client-centered treatment we are providing. Stigma's impact is tremendous. For a client I may be working with, there is adverse effects on their social support, their physical health, mental health, a loss of confidence and self-esteem. It even keeps people from easy access to counseling. The more we perpetuate this stigma against mental illness, the more then people continue to lack the empathy to care for those who have mental illnesses. My role as a social worker in dismantling this stigma would be to work against the negative stereotypes that people with mental health conditions have. To work to call out people who trivialize those who have mental health conditions and the condition by itself. In my role, I can teach and help others to understand better. As an educated white woman, I also hold a position of privilege and a platform to speak out. I can advocate and share my personal story to make many realize that it is normal, it is common, and it is something we never need to be dealing with alone. My takeaway is twofold. Whitaker's anti-medication stance is problematic, but it also is important to learn, understand, and expand upon. We need to find a middle ground to develop the best care for our clients, our friends, our families, and ourselves. And sometimes that means listening to sides of an argument that we may not necessarily agree with. Conversation with those who disagree with you is the best way to make impactful progress towards any outcome. Now, my first thoughts were this. Whitaker's book causes damage to those who are fighting mental illness and also those who are living with mental illness long term. It can be misleading to read his book as it seems to discourage meds, even for the individual who would have a tragic outcome if not on medication. It also further expands the gap between those who are taking This book really challenged me to find out why I disagreed with Whitaker so greatly. I put in a lot of extra reading to really support my uncomfortability with what he was trying to argue. To restate his main points so his argument might be helpful towards what I found to counter-argue with him. Over the past couple of decades we have seen many effective psychiatric drugs brought into the field. Whitaker states that he believes the drugs were really so effective, the psychiatric disabilities would have decreased, but they have in fact, increased drastically. He says that many of the studies supporting his argument show that mental illness patients do better off of the drugs. His conclusion is, psychiatric drugs are bad for people when taken for longer periods of time. To summarize my disagreement and what I have learned from this book and research is that, this only further expands an extreme idea that medication to treat mental illness is not okay, which can be very harmful towards anyone dealing with a diagnosis as such. Whitaker's argument is one extreme in a long dialogue that continues to grow and change, and to be honest, we do not know what truly is the right answer, rather, it is a combination of many areas of thinking, treatment, support systems, and research-based methods along with medication, that will help us to ease the severe and debilitating issues that arise with mental illness.